in the first place.
If we can provide care on an ongoing basis, so we get to know the patients and the patients get to identify with an ongoing physician or other caregiver relationship, the care gets a lot better.
And even though many patients don't pay a penny, it is still cheaper and better for the patient's health than the alternative, emergency care, which is why these community health clinics are so important. Here at the West Side Clinic, they start making pediatric appointments at 8 a.m. By 8:10, there are no open times left. Clinic Director Luce Collins says the clinics have become a lifeline for the uninsured.
I know patients that come to my office that express that they haven't taken their diabetic medication for 6 months because they lost their job, their husband is out of work temporarily, so they don't have the money to either come for a visit or pay for the medication, even if it's only a couple of dollars.
All right, Mr. Hardesty. You have 2 today?
Yeah.
Yeah? Okay, let me pay them.
Where's that? How did you see the Vicodin one?
So, clinic pharmacist Bob Merrick now fills 600 to 800 prescriptions, often free prescriptions, a day.
I don't know what people that can't afford would do. I mean, I don't know what their lives would be like without, someplace to turn and go to. It's definitely, I don't know how the budget works or how they can stay afloat, or because it seems like they give away, everything.
The bottom line, and that's probably the right term to use in this economy for public hospitals, the bottom line is that money doesn't grow on trees for them any more than it does for anyone else, which is why in this day and age they are always trying to cut costs with all the additional patient load without cutting patient care.
Most hospitals wouldn't have 46% of their users unable to pay them. That's not your dream business model.
I want you to see if you can walk on your heels. Can you do that?
But if it's not a dream business model, then how can Denver Health or any other public hospital in the country keep going?
I would say the question really goes beyond how do you manage to keep your doors open and how do you manage to stay financially solvent, to a bigger question: how do you manage to maintain a high quality? And that actually is the quality question is a very relevant question, because in a number of safety net institutions in this country, as they experience financial stress, they let their quality slide.
The key to avoiding that is what they call an integrated system. What does that mean?
It means that you have multiple points of entry, so people don't all have to funnel through your emergency department.
In other words, getting people into the right place at the right time, at the right level, and lowest cost of care. Often that means getting people to the community clinics.
Okay, so tell me what brings you in today.
But if they do show up here at Denver Health's main hospital, they are sent one of 2 ways: to the emergency room if they need it, but to what's called urgent care at only about 1/3 the cost if they don't. Amy Quinones is an urgent care nurse practitioner.
This is a very, very busy clinic. We see usually about 100, 120 patients a day. And even during busier seasons, it'll be even busier than that. So it's always, always going.
Another big key to keeping costs low is Denver Health's surprising but successful reliance on proven models from the business world to reduce costs and create additional sources of revenue.
One of the major ones is we're applying Toyota production systems, or lean.
Toyota motor car.
Toyota motor car. You may say, this lady's crazy. She's running a healthcare system. What do cars have to do with it? Well, it's very interesting. Toyota said, we have to get waste out of our system. And we've saved over $14 million in the last 2 years by applying Toyota production systems to healthcare.
We take the value stream and we map it from the time the patient comes here to the time they leave. Look at each process. What happens to the patient? What happens to us financially as part of the process?
We sent some of our doctors to FedEx and to Dell, and one of our doctors said, well, I don't know what FedEx would have to do with Denver Health. Our patients aren't packages. And he came back and said, wow, if we knew as much about our patients as FedEx knows about their packages, we'd be brilliant.
That means making sure that as soon as a patient shows up,
Linda?
every detail of their condition and the care they receive is tracked to minute detail.
How are you today? Pretty good. Good. Any problems overnight?
Dr. Marissa Burden is a relatively new kind of specialist called a hospitalist. She doesn't just help treat patients who are hospitalized. Like FedEx watches packages, she's here to watch patients like a hawk, to head off small problems before they become big, requiring longer, costlier stays. There used to be 8 hospitalists on staff. Now there are 23.
I think that the type of care that we take care of in the hospital is much more acute and much more severe than it used to be, because nowadays, we can manage certain medical problems like blood clots and things like that. You take the heparin shot, so you don't have to stay in the hospital the whole time. Any abnormal vital or any abnormal lab, we get called immediately, and we're jumping on that problem. If we can cut hospital stay, then that's ultimately saving thousands of dollars each day, and then also by not ordering unnecessary tests, hopefully we can save money on that as well.
Patient with undifferentiated carcinoma found in a left breast. You can see this mass in her left breast that is fairly necrotic.
Step by step, every process here is evaluated and streamlined. Again, like the business model, all medical records are now available electronically so they can be accessed by everyone who needs to see them throughout the system. With everything on computers, there's no more need for costly films and people to file them. This alone saves $300,000 a year.
I'll put you on hold for just a minute. I'm going to compare that.
There is also a cost-saving, easily accessible nurses' phone line so callers can get care without coming to the hospital at all. It received almost 90,000 calls last year. This means Denver Health gets fewer charity cases on its doorstep and saves an estimated $400,000.
At this point, she's going to be fine because it's been so many hours.
And Denver Health actually makes money by operating a poison control center, funded not just by the state of Colorado, but by several western states and private companies. The result? Every dollar spent in poison control saves $7 in health care costs.
It'll help you pay for your medical expenses. If you get it within 30 days, it'll help pay for today.
And when people like Ted Carpenter show up for care, they see enrollment specialists who know the ropes and search for financial aid for which many patients don't even know they're eligible. In Ted's case, for instance, it's the Colorado Indigent Care Program, the state's health care assistance for the poor. Denver Health calculates that enrollment specialists find a whopping $65 million a year that would otherwise be lost.
Where is your chest pain exactly?
It's not my chest, it's in my back.
Or it's in your back?
Yeah.
Over this way?
Yeah, right there.
Okay.
Ted was diagnosed with fractured ribs. His care included x-rays, examinations, an IV, and morphine for the pain. The total cost for his visit to the ER? $2,100, for which Ted paid nothing. Denver Health lost money on this visit, but through the financial aid they found for Ted from the state, at least they got 7 cents on the dollar for his care. But somehow, some people newly down on their luck still haven't found their way into the system.
Donation for the Denver Voice for the Homeless. Donations for the Denver Voice for the Homeless. Hello, folks. Would you like to make a donation today for the Denver Voice for the Homeless? Thank you.
People like Craig Fuller and Margie Mattaccioni.
They won't even look you in the eye.
I know.
6 months ago, they were middle class, with jobs and a place to live. Then, Craig was laid off. The slide to homelessness happened quickly.
Never in a million years would I ever, wake up one day and think that this would actually happen to me. And I've seen homeless people and everything like that. And when I was pulling in $1,800 every 2 weeks, $1,800 every 2 weeks, I was just like everybody else out here. Looking and just saying, okay, or look the other way, and they were invisible to me too. I'll never look at homeless people the same way again. They'll never be invisible to me again.
Your shoes fit you okay?
Mm-hmm. Yeah. I think the main reason that I ended up with this, I had to wear 4 pair of socks because it was so cold, and I slept outside, for the night. It was so cold.
Craig's been going for his health care to just about the only agency in town that's actually taking a load off of Denver Health, a clinic run by the Colorado Coalition for the Homeless. It too has seen a patient increase in this recession of more than 20%.